Powerful placebos, fake surgery heals knees. In an article in the New England Journal of Medicine, Dr. Bruce Moseley is an orthopedic surgeon renowned for the knee surgeries he performed on people with debilitating knee pain. Dr. Moseley designed to prove that his signature knee surgery was more effective than others. Arthroscopy is the most commonly performed type of orthopedic surgery, and the knee is by far the most common joint on which it is performed. Numerous uncontrolled, retrospective case series have reported substantial pain relief after arthroscopic lavage or arthroscopic debridement for osteoarthritis of the knee. Dr. J. Bruce Moseley had 10 patients scheduled for an operation intended to relieve the arthritis pain in their knees. The patients were men, most of them middle-aged, all former military guys. All 10 would be wheeled into an operating room at the Houston Veterans Affairs Medical Center, draped, examined and anesthetized. All 10 would be dispatched to the recovery room and sent home from the hospital by the next morning equipped with crutches and a painkiller. But there the similarities ended. For while 2 of the men would undergo the standard arthroscopic debridement surgery for their condition, the scraping and rinsing of the knee joint, 3 would have the arthroscopic lavage procedure, rinsing of knee joint alone. 5 would have no recognized surgical procedure at all. Their surgery would be a placebo, an exercise in just pretend. The patient was sedated. 3 incisions were made in the same location as those getting the real surgery. The patient was shown a pre-recorded tape of someone else's surgery on the video monitor. Dr. Moseley even splashed water around to mimic the sound of the lavage procedure. Then he sewed the knee back up without actually doing anything. As expected, 1/3 of the patients getting the real surgery experienced resolution of their knee pain. But what really shocked the researchers was that those getting the sham surgery had the same result. In fact, at one point in the study, those getting the sham surgery were actually having less knee pain than those getting the real surgery, probably because they didn't undergo the trauma of the surgery. The placebo worked. 6 months after surgery, the 10 patients still didn't know whether they had been faked out or not. But all of them reported much less pain. But it was suggestive enough to set Moseley and Dr. Neil Bowery on an expanded version of the same research design, this time with 180 patients. Sylvester Colligan, a 76-year-old World War II veteran from Beaumont, Texas, was assigned to the placebo group in Moseley and Ray's expanded study. Colligan's right knee had been giving him trouble for 5 years when a doctor at his local clinic told him he probably had arthritis and suggested him talk to Moseley. Colligan he does know his surgery consisted of only shallow incisions. More important, he knows that he has no pain in his knee now and that he can mow his yard again and walk wherever he wants. The surgery was 2 years ago and the knee never has bothered me since, he says. It's just like my other knee now. I give a whole lot of credit to Dr. Moseley. This study provides strong evidence that arthroscopic lavage with or without debridement is not better than and appears to be equivalent to a placebo procedure in improving knee pain and self-reported function. A placebo is used in clinical trials to test the effectiveness of treatments and is most often used in drug studies. For instance, people in one group get the actual drug, while the others receive an inactive drug, or placebo. The participants in the clinical trial don't know if they receive the real thing or the placebo. This way, the researchers can measure if the drug works by comparing how both groups react. If they both have the same reaction, improvement or not, the drug is deemed not to work.